Welcome everyone to our weekly resident meeting here in the clinic, and that's when we discuss all kinds of questions that we have about patients, trying to clear up any kind of difficulty that the residents are having with regard to a patient or two. And so today, Shirley has a question. Shirley's been with us for about 1.5 years, and we like her very much. So Shirley, what's your question?
Alright, Bob, I'm confused about the scattered pulse. I know scattered pulse can come from deficiency or excess, but how do you tell the difference?
In what position?
In Chun.
Which side?
The left side.
Okay. The question is in the heart position, in the left Chun. How can you tell if the pulse is scattered or if it's just weak? Specifically, these scattered pulses feel like if you put your finger on, let's say you took 5 or 6 acupuncture needles and you laid them right next to each other. And then you put your finger on the shafts of those 5 needles all at once. And you kind of roll across the shafts. That's what a scattered pulse feels like. You know, it can either feel like 3 shafts or 4 or 5, but you're going to feel more than one pulse, usually 3 or 4. Now the big question is, well, is that just a weak pulse, or is it truly a blood stasis pulse in the heart? And a scattered pulse is, by definition, blood stasis in the heart. The key is, if you're confused, look at the other pulses, especially in the left arm. Is the liver pulse strong? Is the chur pulse strong? But specifically, look at the left guan. If the left guan pulse is strong and pounding, then it's probably the scattered pulse in the heart position is in fact a full-blown scattered pulse and needs to be treated with blood movers. If the liver pulse is thin and weak, and all the pulses are thin and weak, and then you have this scattered pulse in the heart, that pulse is probably a weak pulse. Now in both cases, these people have heart murmurs. These are mitral valve murmurs, systolic murmurs, or bundle branch blocks. I find in most cases they are mitral valve murmurs. They're not aortic murmurs, they're mitral valve murmurs. An aortic murmur will have a big amplitude pulse over the entire wrist. It'll be large amplitudes, and then almost always the pulse amplitude will sort of, the pressure goes out from the amplitude under your finger. So you sort of feel the pulse come up, and then you feel the pulse go down under your finger. So it's going up and psh, psh, like this. This is the aortic valve not opening fully, and then the aortic valve is not closing fully, so the pressure gradient between the head of the aorta and the left ventricle, you're losing pressure rapidly because the aortic valve is not closing entirely. But that's a different pulse than a mitral valve pulse. The mitral valve pulses are almost always scattered in nature. It can be scattered and fairly strong, scattered in sort of medium strength, or just scattered and weak. If it's weak, you will have to tonify the heart. The best things to use is Tianwang Bushindan along with Zer Gan Cao Tong. Half and half. So 25 of Tianwang, 25 grams of Zer Gan Cao Tong. The rest of the formula can be whatever else is going on with the patient. But 50% of the formula can be a heart tonic. If the left guan is strong and the left Chun is scattered, then you're probably dealing with a blood stasis pulse. We use variations, but specifically the following formula can be used. Gua Lo Shi Bai Ban Sha Tong, 25. Dan Shen, 25. Circulation Sanjiao, it's a formula sold by Evergreen Herbs, 25. And all that Circulation Sanjiao is Zhui Fu Zhu Yu Tong, Gezhe Zhu Yu Tong, Shao Fu Zhu Yu Tong, with a little bit of Shui Zhi, leech, put in there, like 10 grams. So you can make that formula up in your own clinic. We, in our clinic, we call it Stress 1. So you need 25 grams of that. These are strong blood movers. And then you also need 25 grams of Mao Dong Qing, another blood mover. The reason why you want to use the Mao Dong Qing and the Gua Lo, both not only move the blood, but they are vasodilators, and they take out fluid out of the chest, out of the pulmonary system, and around the heart. because people who have these weak murmur hearts almost always have some form of edema, pulmonary edema, forming in their body. And so the Danshen, or vasodilator, that's a vasodilator. Maodong Xing is a vasodilator. Gualo Shibai, because of Shibai is in that formula, that is a vasodilator. And then, of course, you're using the strong blood movers of Juifu, Zhuyu Tong, Geja, and Shaofu. Okay? So that's how you tell. You look at the other pulses. If you have a lot of experience, then, of course, you'll know immediately that it's weak scattered or strong scattered. But if you don't know, look at the other pulses. They will tell you. Very, very odd to have a weak scattered heart pulse and a very strong liver pulse. You don't see that clinically. Okay? I hope that helps you out. Thank you very much.